Dr. Darren Hocking from Playing Forwards, who we had Victor on earlier. Darren, please feel free to come on and share your presentation with our fine panel and audience.
Thank you, Jerry. Thanks for the introduction, and thank you, HITLAB, for inviting me to present on behalf of Playing Forward. Just by way of introduction, I'm a neuroscientist and academic working out of Australia. Notice the accent. And I've been working with Playing Forward since 2018 on a series of studies using digital game-assisted interventions for making movement therapy fun for children. So I'll talk a bit about the research side of things. I believe that Dr. Victor Talbot's talked a bit more about the actual technology. I'll talk more about the research studies behind the technology. Just by way of an introduction, the problem that we're looking at is that mental health issues have increased significantly even prior to the pandemic. And we now know by 2020, 5.6 million kids, 9.4%, have been diagnosed with an anxiety disorder in the US. We also know that less than 1/4 of children participate in recommended physical activity. And we know that physical activity and movement is very important for developing a whole range of outcomes for children, particularly around mental health. So we know that there's a strong link between having more physical activity and more movement and better mental well-being for children and reduced anxiety and depression. So addressing this link in this lack of physical activity for children is an important focus of the work that we've been doing with Playing Forward. So the solution that we have has used a number of play-based movement therapy techniques with custom characters. So we use animated characters that have been developed in-house, but we've also, I'll talk a little bit about our alignment with some other characters that are well known to children. And we've developed it into a fun interactive app that children can use in the home on standard devices, iPads and iPhones. And as part of these movements, we have clinician prescribed movements that target core body domains that we know are focuses of area that are picked up by artificial intelligence to increase these areas of weakness and increase physical activity in children. Children are presented with characters that they can interact with during the intervention, and they can choose characters that they can then interact with at a period of time. And we develop the moves into fun dance-like movements that children can engage in over a period of time. But one of the big things that we're focusing on is the idea of having algorithms that create an optimal challenge for children. So we use the technology within the more latest iPhones and iPads with depth cameras to actually measure movements during the interaction, so that then this increases the challenge in a closed loop system, so that children are constantly challenged with movements, but not over challenged, so that they become frustrated and quit the activity. Just a bit of a snapshot of the research development timeline from where we started. We started working on a virtual reality game as our beginning proof of concept study. We created a version of a virtual reality game, which has been the basis for the game that I've talked about in the screen before. And this proof of concept allowed us to develop the motion capture technology behind the technology. And we did this in a group of children with autism spectrum disorder, where children interacted with customized characters during game-based therapy. And part of this was to develop a proof of concept of that actual technology. We published that study this year in the Journal of Neuroengineering and Rehabilitation. We moved in 2020 to signing a royalty-free license with Nickelodeon to use characters from their set. Dora the Explorer and SpongeBob within these games to engage children more in that. And I'll talk a bit about the findings relating to that, that study. And then we moved to programming therapeutic motion capture software on a low-cost portable device. So moving it away from fixed devices within virtual reality and Microsoft Connect to using them within low-cost portable devices. And then I'll talk a bit more about the study that we did looking at acceptability and feasibility of using the Nickelodeon content within the mobile app. And I'll touch on our more recent studies that are looking at using this app within a study to look at the efficacy of this within improvements in mental health in children. So just a touch on the Nickelodeon study. We had a study of children. We enrolled 49 children. Our final sample was 46. We randomly allocated them to a branded condition where the Nickelodeon content was part of the movements that the children performed. And we also had a generic condition where there was no active content of the branded condition. We measured a whole range of aspects, particularly around app usage and retention, but particularly around engagement and acceptability. And we asked some questions around feedback on the actual usability and motivation of them to perform in those movements. So our research question was really, do branded entertainment characters improve adherence to engagement during a novel exercise-based program when compared to the generic characters? What we found was that we saw 2 times the retention rates in the condition where we had Nickelodeon content as part of the movements that children performed. So children over a period of 14 days were more engaged during that period. So they were less likely to see attrition of those engagement with the app. We also actually saw significantly increased app engagement. So children spent 65% more time across all therapy sessions, and they earned more points. So they're able to earn points as part of the interaction with the app. So they earned 58% more points in the condition where they had the content, the Nickelodeon. In terms of acceptability and usability, the Nickelodeon content was rated more highly for usability and acceptability. So parents and children reported that they were more motivated to use the app, 23.6%. They were more satisfied with the app, almost 19%, and 28% were more rated the app as suitable for their age group. So the next steps for us is to look at these promising findings in a much larger sample. So we're interested in looking at the next steps of examining the preliminary efficacy of the study with a larger sample size. In our previous study, we showed some changes in their fun and interactivity with the app and engagement and acceptability, but we want to develop this further into a larger trial. And we've got a new app, as I alluded to before, which has all the proprietary algorithms that we had from the previous studies, which we're calling Dr. Moo's A&D app. And we're going to be conducting a preliminary efficacy study with a larger sample size. So we're looking at more like 300 children with an increased intervention period. And a focus more on mental health outcomes, and we'll randomly allocate children to different conditions, including a waitlist control. Our trial supervision is with Project Wilbur, which is a strategy company and marketing company that is assisting us with some of the outreach, and will be assisting us with some recruitment for the larger sample size. But it'll also be looking at aspects of trial with us, including recruitment and screening and study coordination and data acquisition. So just to touch on our partners here, we have a range of partners that have been involved, particularly with the study with Nickelodeon. We were lucky to work with Deauville college. We also had Nickelodeon as a partner with the content. We've been working with students at Northeastern University on different processes to look at FDA approval and looking at use cases of other competitors in the field that are working in this space. Obviously been working with HITLAB for the initial studies that we did in the virtual reality and Columbia University. So thank you. I just wanted to touch on the team here. This is the team that are involved in Playing Forward, with Victor was on earlier. And we also have a team of researchers that work on AI and project management and strategy. And so I'll finish up there.